Come in.
Hello, nice to meet you.
Hey, nice to
My
meet you.
name's Briley. I'm going to be your nurse practitioner today. How you doing?
Good, how you doing?
Good. Is it okay if I wash my hands? We'll take a seat and we'll do some talking?
Yeah, of course.
Perfect. So I washed my hands before I came in, but I'm just going to do some hand sanitizer. So first, go ahead and tell me your name and date of birth, please.
John Doe, 8/16/95.
Perfect. And what brings you in today, John?
Just general checkup.
Okay, so today we're going to focus on doing a focus exam of your neurological system. We'll first do some chatting about any symptoms you might be having, and then we'll follow it up with a physical exam, where I'll go ahead and test some cranial nerves and test some sensation, coordination, balance, and your deep tendon reflexes. Sound okay with you?
Yeah, absolutely.
Perfect. So have you had any headaches recently?
Nope.
No blurry vision? Dizziness?
Nope.
Have you had any episodes where you've passed out? Good. Any numbness or tingling? Any balance problems?
No.
No coordination difficulties?
No.
All right. Do you have any other symptoms that you want to let me know about?
No, nothing.
All right. Well, if it's okay with you, we'll go ahead and get started on the physical exam.
Yeah, absolutely.
Perfect. So as I mentioned today, we're going to be doing some tests that go ahead and test the cranial nerves. And the first nerve is going to be the cranial nerve number 7, and that's the facial nerve. So I'm going to have you do is just go ahead and close your eyes and give me a smile. Perfect, that was good. The next nerve we're going to test is cranial nerve number 5, trigenital, and we're going to do this by, you can open your eyes, by checking your jaw strength. So I'm just going to gently touch on your jaw and go ahead and squeeze for me. Perfect. The next thing we're going to do is test cranial nerve number 5. Cranial nerve number 5, and this is trigeminal. We're going to do the 3 divisions of the nerve, okay? So you have your ophthalmic, your maxillary, and your mandillary. I'm going to take a soft item and a hard item, and I just basically want to know if it feels equal on both sides. Alrighty, so go ahead and close your eyes. Okay.
Mm-hmm.
Even?
Yep.
Good.
Yep. Yep.
Perfect.
Mm-hmm. Mm-hmm. Yep, the same.
Perfect. So the next cranial nerve that we're going to check is cranial nerve number 2, and this is the optic nerve. I'm going to do this by examining your pupillary response, okay? For this exam, I'm going to dim the lights.
Okay.
So I'm going to go ahead and just use a cell phone. I want you just to look forward for me, okay? I'm going to shine a quick light in your pupils. Good. Go ahead and look at the light. Perfect. So I use this little guide right here that I can compare to your eyes, and you're sitting about 3 millimeter, which is a good sign. So the next cranial nerve that I'm going to be checking is cranial nerves 3, 4, and 6, your oculomotor, trochlear, and your abducens. We're going to do this test by checking the 6 positions of gaze. Okay, so I'm going to have you just take a look at my finger and just follow along with just your eyes only. So what I'm doing is I'm checking to make sure, one, that you can follow along with just your eyeballs, but also that you're having a very smooth transition and I'm not seeing any bouncing, which is a good, and yours was perfect. Okay, so the next test we're going to perform is the Rosenbaum chart vision test. This is going to be testing the optic nerve, which is the cranial nerve number 2. So I have my Rosenbaum eye chart. I'm going to stand about 6 feet away, and I want you to go ahead and cover your right eye, please. So we're going to be checking your left vision, and I want you to go ahead and read off the first line. And as I say next, that just means we're going to go down to each row. Okay, so go ahead and begin.
E.
Next.
L.T.
Next.
F.P.H.
Next.
O.L.C.F.
Next.
D.H.J.B.S.
Next.
E.P.T.Z.O.
Next.
C.F.D.H.J.
Next.
L.T.F.P.H.
Perfect. So that go ahead and lets us know that your left eye is 20/20. Go ahead and cover your right, please. I'm sorry. Yeah, your left. Go ahead.
E.
Next.
L.T.
Next.
F.P.H.
Next.
O.L.C.F.
Next.
D.H.J.B.S.
Next.
EPTZO,
Next,
CFDHJ,
next.
LTFPH.
So also your right eye is 20/20. So the next test we're gonna do is on cranial nerve number 7. This is the facial nerve, and we're gonna test using the whisper test. So just go ahead and hear what I say and repeat it back.
TWZ, 18W,
Perfect, and I'm gonna come to the other side. We're gonna repeat the same thing.
F81, WZT.
Perfect. So the next is cranial nerve number 1, which is the olfactory, and this is to test for smell reception interpretation. So this test is a little bit more difficult to test for because I can't obviously smell what you're smelling. So I'm just gonna ask, are you having any difficulty with smells?
No.
You think you're able to interpret and know exactly what it is you're smelling?
Yeah.
Perfect. Excuse me. So next cranial nerve is cranial nerve number 9, the glossopharyngeal, and this controls your swallowing. So go ahead and just swallow for me. This is your voluntary movement of being able to swallow. Any difficulty?
No.
Perfect. The next test we're going to perform is on cranial nerve number 10, and this is the vagus nerve. So the vagus nerve, if correct with no abnormalities, it'll show that the uvula is going to rise when you're talking or when you're making noise, and it comes back down to normal when you're quiet. So just go ahead and open and make an ah sound. Now stop. Go ahead and leave your mouth open when you stop. Good. So when you stop, it's relaxed, it's hanging down, and when you make noise, it rises back up, which is a normal finding. Okay. Next, we're going to test cranial nerve number 12, the hypoglossal, which is the nerve that controls the tongue. So I just want you to go ahead and stick your tongue out of your mouth. Perfect. Now go ahead and move it to the left. Good. To the right. Perfect. So no abnormalities there. The next test we're going to do is on cranial nerve number 11. This is the spinal accessory the spinal accessory nerve. We're going to do this by a shoulder shrug test. So I'm going to have you shrug your shoulders, and I'm going to perform some resistance to see how he responds. Good. So he's able to overcome resistance, which is a normal finding. The next test we're going to do is on cranial nerve number 11, and we're going to assess the sternocleidoid mastoid muscle. I'm going to do this by gently placing my hand on John's cheek, and I'm going to have him turn to resist. So go ahead. Good. Perfect. So just a light bit of pressure there, and he has no problem overcoming the resistance. Next, we're going to go ahead and test the strength in all 4 extremities. I'm going to do the upper extremities by having you raise your arms out in front of you, and I'd like you to go ahead and resist. Perfect. And now we'll do your lower extremities. Perfect. Good. So he's able to fully overcome resistance, which is a normal finding. Now we're going to do the deep tendon reflexes. I'm going to go ahead and assess your your triceps, your biceps, your brachial radius, your knee, and your ankle reflex, okay? For the tricep, I'm going to go ahead and take your arm, and I want you just to go ahead and completely relax the arm. I'm going to be testing the deep tendon reflex that runs along the back of your tricep, okay? So make sure it's completely good. Good. So when I did it, I felt a small tense in the muscle here, and your arm just gently raised just a little bit. So we'll go over here. Perfect. Go ahead and release. Thank you. Good. So right here when I touched, you flexed, and I saw your arm just gently come out to the side. Next, we're going to test the bicep tendon reflex, and by doing this, I'm going to have the patient, John, go ahead and just flex your arm just a little bit, and then I'm going to locate where I feel the tendon. It's right here, and it feels like a thick cord. Go ahead and put your arm back down. So now that I know where the tendon is, I'm going to apply a little bit of pressure. Relax. And as I do that, I feel just the slightest little bit of tension in the bicep muscle and also down in the forearm. And we'll repeat again over here. So we find it, it's right here, good. And again, same response on this side. Next, we're gonna go ahead and do the knee jerk, deep tendon reflex. So if you can scoot back, we'll go ahead and do the knee. Thank you. Go ahead and relax your legs. Good. Good, and that's also a really good response. That was a big one.
Yeah, right.
Okay, now we're gonna do the radius. So the radius is just a little bit harder to find because you can't feel that cord reflex like the cord tendon like you can in the others. So you just kind of start, and you're gonna move about 3 centimeters up. Thank you. And this one's a little bit different. Basically, you're just gonna see a small movement in your wrist. You might feel it. Yep, that was a big one. And over here. That was good. All right, and next is the ankles. I'm just gonna take your foot. Go ahead and relax. Relax your foot. Good. Good. Relax for me. Thank you. Good. Okay. So now we're going to go ahead and test the plantar response, which is also known as the Babinski. In a small child under the age of 2, when the bottom of the foot is stroked, you'll see the toes spread open, but in someone over the age of 2, we want to see more of the foot kind of curved down when touched with a blunt object. So go ahead and relax. Good. And relax. And the toes go down. Perfect. So the next test we're going to perform is a sensory test, and we're going to check the sensation in all 4 extremities, okay? So again, I have the soft item and I have the sharp item, and I want you to close your eyes and let me know, what am I touching with? Is it sharp or is it soft?
Soft. 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 Sharp. Sharp. Soft. Sharp. Soft. Sharp.
Perfect, and now we're going to test the lower extremities.
Sharp. Soft. Sharp. Sharp. Soft.
Perfect. So next we're going to head and do some coordination tests. The first test I'd like to do is the heel to shin test. So I'd like you to take your left leg, and with your heel I'd like you to rub it up and down your right leg shin. Perfect, and go ahead and repeat on the other leg. Perfect. The next test I want you to do is I want you to put your hands out down like this on your legs, and then I want you to touch your legs back and forth. Perfect. And now we're going to do the finger to thumb on both hands. Perfect. Other hand. Perfect. So the last test we're going to perform today is a gait test. I want you to stand up, and this test is performed in the office with no shoes on. I just want you to go ahead and walk back and forth twice. Good, you can go ahead and sit. So I can tell that the gait is normal and there are no abnormalities in balance based on the fact that the heel touches the ground before the next foot starts to move. These are all normal findings. This concludes the portion of the neurological exam. Do you have any questions for me?
Nope.
Well, thank you so much for participating.
Thank you.
Have a nice day.